You have likely seen the headlines about a possible COVID therapy that comes from the oleander plant. We've had our verified team looking into the claims about the treatment and what's true and false. Here's our Jason Puckett.
Oleandrin, it's claimed to be a natural therapy to stop COVID-19, and it's being pushed by Michael Lindell, the CEO of MyPillow, and Housing and Urban Development Secretary Dr. Ben Carson. Now, they want President Trump to have the FDA consider it as a COVID treatment, but many headlines and stories claim oleandrin is dangerous. So we're verifying, is oleandrin an approved treatment for COVID-19? To verify, we checked with the U.S. National Library of Medicine, Memorial Sloan Kettering Cancer Center, and the National Cancer Institute. Now, Memorial Sloan Kettering says oleandrin is an extract from the oleander plant. It's claimed to be able to treat cancer, heart failure, hepatitis C, and even AIDS. But they warn that the plant, oleander, is, quote, highly toxic. It's actually classified as a poisonous substance by the National Library of Medicine, which also includes oleandrin as a poisonous ingredient. Now, in June, researchers at the University of Texas in Galveston tested oleandrin on kidney cells of monkeys infected with COVID-19. They found that it, quote, inhibited replication by up to 3,000-fold. However, right now, there are no studies on human COVID cases. And this study hasn't been peer-reviewed yet, meaning we don't know if the results can be repeated. There are also competing interests in that Galveston study. Two of the researchers are paid by Phoenix Biotechnology. That's the U.S. company that makes oleandrin. And last week, Mike Lindell, the CEO of MyPillow, was added to their board of directors. So here's what we can verify. Oleandrin is not currently an approved COVID treatment. The research and people pushing for its use have financial ties to the company producing it, and medical experts warn that it can be toxic if improperly used. With your Verify, I'm Jason Puckett.